deep breaths with your lungs. Say, ah, ah. Very good.
We're utilizing the facility for his hypothyroidism, something that we found when he was born, that his thyroid is not functioning. As a parent, you would do anything for your children. You do not have to worry about missing work, just the time that you would have to be in traveling. So it allows us to have the same quality care.
So many times these children in our area do not have access to pediatric specialists. The closest pediatric specialist we have is Atlanta or Augusta, and that's a 3-4 hour drive. Health expenditures that these families actually have to endure, it becomes a financial burden for them. Well, Valdosta's, I don't think it's a big city, but it's big enough for a good family to raise your family in. It's located in rural South Georgia. We're about 20 miles from the Florida line, and we're about 4 hours from Atlanta. It's a small community. A lot of people know each other. Big on football, activities for your kids, so it's a good community to live in.
Right now in Georgia, all 159 counties are connected to Telehealth, which is our two-way video conferencing platform that we use for a variety of services, whether it just be one-on-one consultations, breastfeeding education, nutrition education, professional development, distant learning for our nursing staff, but we also use it for two-way video for patient education, behavioral health, mental health consultations. On top of that, we have about 28 telemedicine programs currently deployed throughout the entire state. Our goal is to increase that to about 50 in the next 2 years.
Telemedicine Cart, very standard Cisco component. It's got a codex, monitor, all the different attachments and components for peripherals. We like this one because it's very easy to navigate.
We use all Cisco-based software, and we made sure that we were all connected at the same time in real time.
The goal was to connect all 159 counties within the state of Georgia. We needed dedicated connectivity, so we had to make sure we have quality of service running over our internet connections. Symmetrical bandwidth tested out to be the best versus asymmetrical, which guarantees us the same speeds up and down. So we have the hub for telemedicine network. Each site connects to a remote location to a router located on each end that provides end-to-end connectivity, security, and encryption measures. Off of each router is a switch. Off of each switch is an endpoint, such as a telemedicine cart or a video conferencing unit.
Our relationship with CDW is fairly new, but we're really excited about it. They were able to take a lot of site visits and visit our health department sites, and then also visit our district offices and see how we incorporate not only video, but the telemedicine and the customer satisfaction kind of side of things, and guide us as we're looking at roadmaps and sustainability programs and expansion of services to really tell us what's best suited for our clients, and not only just from a cost perspective, but really analyze those details and tell us what direction we should be going in, and then what will be the best cost-saving measures for us to sustain such a program.
In the state of Georgia, they definitely have the families concerned, and this is a very good way to help families have access to where you don't have to have all the logistics of rooting up a family and having to take them to doctor appointments and things of that nature.